ends of luer connectors, bungs, hubs and ports. An effective aseptic non-touch technique is an essential prerequisite to any vascular access procedure.
After collecting and checking the drug chart for your patient, including their allergy status, go to the designated preparation area on your ward. Collect a plastic tray and clean it with a detergent wipe if there is any physical contamination on the tray. Allow time for it to air dry. Now wash your hands thoroughly with soap and water or Alco-Gel. Wipe the dry plastic tray with 70% alcohol solution. Leave it to air dry. This tray is now your aseptic field. Collect all the items you need for your task and place them next to your tray. Now you need to decontaminate your hands by using Alco-Gel. Put on a pair of gloves. Peel open the packaging for the syringe and the needle, taking care not to tear the paper. Tearing the packaging can create viable airborne particles, which may then lead to contamination. Assemble the needle and syringe, ensuring the key parts are not contaminated. Place the assembled needle and syringe into the tray. Repeat these steps for all syringes and needles needed for giving the medication. All liquids must be drawn up using a needle. This includes drugs in plastic ampoules. Remove any dust caps from vials and wipe clean the exposed bung with 2% chlorhexidine in 70% isopropyl alcohol, such as a Sanicloth 2% wipe. Allow to air dry by the side of the tray. Now draw up the flush. It's essential to ensure that the key parts are not contaminated during the procedure. Make up the dose required in accordance with the appropriate drug monograph. Once the drug is prepared, either replace the exposed needle with a sterile cap or a new sheathed needle and place it carefully in the tray. Take the plastic tray to the patient's bedside as soon as possible for administration. Remove your gloves and dispose of them appropriately. Now decontaminate your hands using Alco-Gel. Explain the procedure to the patient and gain their consent. Put on a disposable apron. Gain clear access to the intravenous device. If the device is a central venous catheter, observe the insertion and exit site for signs of infection and take appropriate action. If the device is a peripheral cannula, check the insertion site using the Visual Infusion Phlebitis score. Decontaminate your hands with Alco-Gel again. Put on a pair of appropriate gloves. Clean the injection port you're going to use with 2% chlorhexidine in 70% alcohol and allow it to air dry. Drying takes approximately 30 seconds and is a crucial step. If the port is not dry, it's not aseptic. Administer the flush and drugs in accordance with the relevant trust monographs. Using this aseptic non-touch technique, you'll reduce the risk of introducing infection into your patient's bloodstream. Dispose of all used equipment appropriately. Remove and dispose of your gloves and apron. Decontaminate your hands with Alco-Gel again. Complete the drug documentation and record your observations in the patient's healthcare record. Clean the plastic tray with a detergent wipe and return to its designated area.
Up until now, several different practices existed for the administration of IV drugs. We are now aiming for a standardised approach. By following the technique in this film, you will greatly reduce the risk of your patient getting a bloodstream infection.